So what is the difference between a disorder and the normal range of abilities and personality? All behaviors fall along a continuum or spectrum. At one end of the spectrum is normal behavior, abilities, individual characteristics that are considered appropriate or typical on the basis of an individual's culture, age, gender, and so on. At the other end of the spectrum are groups of behaviors that, when exhibited regularly by an individual, create problems for that person in terms of his or her functioning socially, emotionally, or occupationally. Now, most people have certain idiosyncrasies, for example, unusual hobbies, anxiety, awkwardness in social situations, clumsiness, obsessions, and so on. Now, this is considered well within the range of normal behavior. However, when these behaviors overlap, form a pattern across time, and negatively impact a person's ability to function, then they're viewed as clinically significant and as requiring a diagnosis and treatment. Now, there's a lot of controversy about the diagnosis of ASD level 1, formerly referred to as Asperger's. Some people view this as simply a different way of thinking and viewing the world. Added to the mix is concern that people with poor social skills are being pathologized. In other words, the loners are now qualifying for a diagnosis. Our society expects people to be social, and when they're not, should we view them as sociopathic or disabled? Simon Baron-Cohen explored this argument and looked at both sides. He suggested that many of the behaviors associated with the disorder represent a focus on things rather than on people, and they spend most of their time completing tasks rather than socializing. If placed in a different environment, Baron-Cohen believed that Asperger's would not be seen as a disorder. He also pointed out that people on the autism spectrum tend to meet the majority of developmental milestones on time. Now, in contrast, he also discussed two reasons to continue to consider ASD a disorder. One, so that individuals with the diagnosis could have access to support at school and in the work environment and within the community. For example, some insurance companies will pay for the affected individual to get treatment and outpatient therapy. And two, because of lack of empathy, that is theory of mind, can create significant problems emotionally for people on the autism spectrum. So in summary, a disorder is a behavioral or mental pattern that causes significant distress or impairment in a person's ability to function effectively and consistently in day-to-day living. For example, physically, mentally, emotionally, socially, financially, vocationally, and even spiritually. Now this is where some controversy enters the picture, because many, if not most, people on the higher end of the autism spectrum would say they function just fine in most areas of life, although most would admit to certain areas of struggle as well.